Hello, and welcome to our webinar. Our topic today is bloodborne pathogens. My name is Todd Culver, and I'm the president and CEO of Encompass Michigan, the statewide network of comprehensive human service providers working together to develop independence and achieve inclusive communities. This material was prepared under a Consultation Education and Training grant awarded by the Michigan Occupational Safety and Health Administration, or MIOSHA. Encompass Michigan has a long-standing and valued partnership with the MIOSHA SET division, and we appreciate their leadership in keeping workers safe and healthy throughout the state. Our objectives for the training today include a review of the relevant MIOSHA standard, including the responsibilities that it creates for employers, as well as some of the accompanying requirements, several of the definitions that are contained within the standard. We'll review the diseases that these pathogens can cause, as well as the situations that can put employees at risk, both by job task and category. And most importantly, we'll review how to protect yourself so that you can stay safe. The relevant standard is Part 554 of the MIOSHA General Industry Standards, Bloodborne Infectious Diseases. And the primary responsibility that it creates for employers is to conduct what's called an exposure determination. That's where an employer evaluates routine and reasonably anticipated tasks, as well as procedures, to determine whether there is actual or reasonably anticipated employee exposure to blood or other potentially infectious material. And we'll talk about what some of those terms mean more in a moment. What it basically means is if, as an employer, we're asking our employees to get involved in situations where they could be at risk of being exposed to another person's blood, then as an employer, we have to do something about that. We have an obligation. And the first of these is to maintain a list of those job categories where an employee may be exposed. Those are referred to as Category A jobs, as they're referenced in the standard. An accompanying requirement is to conduct training. And it's required for all employees who face exposure as part of their job duties. It needs to be provided at no cost and during working hours. It should be provided at the time of initial assignment to the job task or category that puts the employee at risk. And this is one of the MIOSHA standards where there is an annual refresher requirement, meaning it needs to occur every year. It's also required that this training be delivered at appropriate levels to promote and ensure employee understanding and maintain their safety. With some of the definitions that are contained in the standard, the first is bloodborne pathogens themselves. These are pathogenic microorganisms that are present in human blood. That means a germ, a virus, or a bacteria, something that can make you sick. And the illnesses that these pathogens can cause include hepatitis B, the human immunodeficiency virus known as HIV, or hepatitis C. The other term that's important to acknowledge is contaminated, which represents the presence or reasonably anticipated presence of blood or other potentially infectious materials. And what does that mean? Well, other potentially infectious materials, or OPIM, include semen, vaginal secretions, amniotic fluid, synovial fluid, as well as saliva in dental procedures because of the risk of the presence of blood. Not included as an OPIM is vomit, urine, feces, sweat or tears, or even spit. And you'll note the asterisk under not included, indicating that unless any of these materials are visibly contaminated with blood, in which case, of course, they do become potentially infectious. In terms of the situations that can put employees at risk, primarily for those involved with community rehabilitation organizations and many small businesses, potential exposures include contact with non-intact skin. An example of how that might happen includes the rendering of first aid without protective equipment. And the person or employee providing that first aid may have a cut, sore, or scratch on their hands, and those non-gloved hands make contact with another person's blood. That would be an exposure. The next situation is through contact with mucous membranes. Those are the eyes, nose, and mouth. That can occur when there's a substantial amount of blood present through a splash, or perhaps through accidental secondary contact with contaminated gloved hands and a face. If an individual or employee has rendered first aid, applied pressure to a wound where blood is present, and then inadvertently made facial contact afterwards, that would be an exposure. And the third risky situation is through a wound from a contaminated sharp object. That means a dirty needle or broken glass that has blood on it. In an appendix to the MIOSHA standard, there is a list of the job categories that are examples of jobs that could put employees at risk. This, of course, includes healthcare personnel such as doctors and nurses, as well as dentists and dental care workers. But it also includes other categories that we find in many businesses, such as housekeepers, janitors, and maintenance workers. The signs and symptoms of these diseases include for hepatitis B, the symptoms are often mild and flu-like in nature. They include fatigue, stomach pain, loss of appetite, and nausea. Further progression of the disease can lead to jaundice, which is a yellowing of the eyes and skin, as well as darkened urine. However, individuals infected with HBV will often show no symptoms for some time. Hepatitis C or HCV can be asymptomatic or result in mild illness as well. If symptoms do occur, 1 out of 5 may experience jaundice, the dark urine, or flu-like symptoms outlined above. After acute infection, up to 1/4 of persons appear to resolve their infection without treatment. But regardless of how the HCV infection is resolved, it does not provide immunity to reinfection. Chronic HCV infection develops in the remaining 75 to 85% of persons infected, with unfortunately chronic liver disease developing in 70% of these cases. Extreme fatigue is very common as a symptom in persons with chronic hepatitis C. With HIV or the human immunodeficiency virus, this can also be asymptomatic or result in mild illness. People may not have any symptoms when first infected. Within a month or two after exposure to the virus, flu-like symptoms may include fever, headache, fatigue, or enlarged lymph nodes. Other symptoms, often experienced months to years before the onset of AIDS, include lack of energy, weight loss, frequent fevers and sweats, and persistent skin rashes or flaky skin. There is a vaccine, preventive vaccine, to guard against hepatitis B infection. And the good news is that the number of new infections has declined dramatically in recent years, primarily due to routine vaccination. The series consists of 3 shots that are administered over the course of 6 months. And the Centers for Disease Control and Prevention, or CDC, recommends vaccination for everyone under 18 years of age and any adult who is at risk, including through their job tasks. There is a MIOSHA requirement that relates to the vaccine series as well, and that is within 10 working days of the time of initial assignment, an employer shall make the hepatitis B vaccination available to each employee at risk of exposure. And if an employee initially declines, but later decides to accept, the employer shall provide the vaccine at that time. There is an option, particular to those who provide first aid, and that is that employers may postpone offering the vaccine series if the primary job assignment is not rendering first aid. In other words, if it's only collateral duty. It must, however, be offered within 24 hours of an event where the responder renders assistance in any situation involving the presence of blood or other potentially infectious materials. The next important concept for bloodborne pathogens is how to protect yourself. And the primary method for protection is really a mindset that's referred to as universal precautions. And summarized simply, it means be careful all the time. That we should assume that all human blood, and in fact all body fluids, are infectious. And that means whether treating an injury or conducting a cleanup, use universal precautions before you get involved. Take the necessary steps to make sure any potential infection or infectious material doesn't get in your system, doesn't get on your skin, and you'll significantly increase the probability of staying safe and healthy. The application of universal precautions involves using personal protective equipment, or PPE. The main item of PPE that's relevant here is single-use gloves. They can be latex. Some employees develop allergic reactions to a latex material, so nitrile or vinyl gloves should also be available. For the rescue breathing portion of CPR, a mask should be available as well to prevent or to establish a protective barrier. And eye protection should also be available, as well as surgical masks and gowns or other protective clothing in the event of a serious incident. Gloves, however, are the, again, primary PPE item, and it's important to know how to remove the gloves safely. The first step after a cleanup is completed or first aid has been rendered is to grasp the outside of the first glove to be removed with the opposite gloved hand, to pull off the glove away from the body, and then turn it inside out. We would then hold that removed glove in the remaining gloved hand, and then slide the fingers of the ungloved hand underneath the remaining glove at the wrist, and peel the glove off over that first glove. The nice, neat package that results can then be discarded into a waste bin safely. And the first thing that we should do next is wash our hands vigorously with soap and water. So in removal of PPE and hand washing, we've covered the proper disposal of single-use gloves by turning them inside out and placing them in designated containers. And the same should be true of any protective clothing. If clothing has been contaminated that is not single use, it can be washed. The best disinfectant for that is a bleach and water solution, which can be diluted up to 1 to 100 and still maintain its disinfecting qualities. And then again, washing hands and any other exposed skin with soap and water, bearing in mind that waterless disinfectants as well as alcohol wipes can be effective, but a sink with soap and water is likely our best bet. In terms of cleanup procedures, always wear that personal protective equipment, or PPE. Bleach and water solution in this instance for cleanup, a 1 to 10 ratio is appropriate, or any disinfectant that's noted as EPA registered and effective against bloodborne pathogens is also appropriate for use. If we are ever cleaning up sharp objects, please use tongs or a brush, broom, and dustpan to pick up the broken glass, never to use our hands, not even gloved hands. If regulated waste results from the cleanup, contaminated waste that makes it a regulated waste product, this would include liquid or semi-liquid blood or other potentially infected materials and any contaminated items that are saturated with blood. And these should be disposed of by placing in a closable biohazard or red-colored container. The symbol of a biohazard, as well as an example of a biohazard container, are depicted on the screen. A Kleenex or a Band-Aid with a small spot of dried blood does not become regulated waste. It should, however, be encapsulated in another absorbent material, such as another tissue, but then could be placed in a sealable plastic bag and enter the regular waste stream. The last requirement under the standard that we'll cover is to maintain what's called an exposure control plan. And this is required under the bloodborne infectious diseases standard for all employers who are impacted. It outlines the exposure determination, or who among the employees of that employer are at risk of exposure. The hepatitis B vaccine policy should be stated there, with options for both employees and employers. The control methods for employee protection that include what we've outlined, that is universal precautions, personal protective equipment, hand washing, and regulated waste disposal. And if there are dirty needles involved, not often the case in non-healthcare facilities, but if dirty needles are involved, there is a special container for their disposal as well, and they do become regulated waste. An evaluation process, if an employee is exposed, that's called post-exposure evaluation, is also required, and it will be described in the exposure control plan. These are the reporting requirements that includes immediate treatment for any exposed employee, as well as ongoing follow-up with defined protocols. The training process will be outlined here as well, and that is the training should be provided initially when the employee is assigned to a task that places them at risk, as well as that annual refresher requirement. And then the record-keeping requirements that the employer is bound by under the standard that includes certain medical records in the event of a serious exposure, as well as training records and a special documentation form called a Sharps log in the event that the employee experiences an exposure by that means. Thank you for joining us for this training webinar today. Please stay safe and healthy out there. On the screen is a list of citations of resources that were utilized in development of this training, primarily MIOSHA resources, as well as those from the CDC. Thank you again, and a reminder that this material was prepared under a Consultation Education and Training grant, and we remain very grateful for our partnership with MIOSHA. Thank you, and be careful out there.